Well, good afternoon, folks. Welcome to this afternoon session at the Planetary Health Conference 2024. My name is Arnold Sikkema, and I'm a physics professor here, and I've been delighted to be involved in helping organize the conference here. I'm the executive director of the Canadian Scientific and Christian Affiliation, which is co-sponsoring this conference. So our first speaker is Enrique Castro-Sánchez, who is from BRUNEL University in London, England. And he's a senior lecturer in global challenges in planetary health and the director of postgraduate research at the Division of Transdisciplinary Studies in Global Change. And I'm sure he'll tell you the title of his talk. And welcome, Enrique.
Hi, I'm Enrique Castro-Sánchez, and I just would like to offer you some reflections about how and where politics and policy awareness fitting in planetary health education and research and practice. This is my declaration of interest, and obviously this presentation only represents my opinion and not necessarily of my employers, any of the affiliated organizations. And as usual, I like to present my declaration of biases. So this overview, this view of education and policy simply reflects the many biases that I have and that they color this experience. So I just like to put them out there. I suppose that in a planetary health audience, it's not surprising that we are facing planetary threats such as the climate crisis and biodiversity loss and the consequences of such issues, the jump of infections from animals to humans, global conflict, as well as the effects of globalization and the response to migratory movements. I suppose that all those topics are so important that have been highlighted as key global health, planetary health topics by the World Health Organization and many other organizations. But I suppose as well that we know that it's not that we're facing critical and vital planetary threats, but they all seem to be happening at the same time and everywhere and all at once. And this perma-crisis, poly-crisis is something that's quite different from previous epochs, if you want to put it that way. Perhaps this is my view, that those global threats are not just there as a determinant of what's going on, but they may be the symptoms of a global malaise that is actually political in origin, and that it depends and it shapes our political systems, our productive systems, economic systems, and transport systems. Now, for me, this perma-crisis is a really painful but useful stress test for all the clinical and social and cultural, economic and nursing models that we have had and that we have. So it is painful, but I find that it's useful. And that's why we can lean on some of the foundational pillars of planetary health and planetary health education to try to think about how we can address this, supraplanetary threat, which is capitalism. Within the planetary health education pillars, we mustn't forget that we've got that movement building and systems change. We have got that aspiration for working towards equity and social justice. And we also have got this global agenda and priorities. So it seems that political skills are really well suited, but also are very much needed to be able to implement all these pillars. If you think about as well, the more modern and bigger picture models that we have about the underlying drivers of planetary health, you can see all the way to the left, consumption and technology and demographic shifts are really, really what we think nowadays are shaping all the other health effects that we've got all the way to the right. So there is this powerful and needed connection to political skills. Often in nursing, we hear these claims that nurses must have a seat at the table, and that's probably right, I suppose. But once we are there, what is it that we would like to speak about? And typically, we are very good talking about the topics on the left, which is about working conditions and health conditions and sort of like the health system. Often, or much less frequently, we talk about the issues in the middle, about our social justice and equity, but hardly ever we hear nurses talking about that bigger picture, the planetary threats, the planetary determinants, the planetary issues. So if we are thinking about incorporating those political skills, that political astuteness and political influence, political literacy, then we really need to, I suppose, think about what is it that we're going to do in terms of these threats in relation to that happiness and well-being and benefit and social justice. And again, these are some of the examples around the world where that social equity and justice needs the use of political skills. Some colleagues around the world, I'm very fortunate to work in Pakistan. Colleagues around the world will tell us, well, we do suffer the most important floods ever, but our contribution to the climate crisis in terms of emissions has not really changed over the last 30 to 35 years. And colleagues in Brazil will say the same. So these are examples of that application of the political skill that we need to think about how to use it. Thinking about the improvement on health around the world, we have been very good about thinking on implementing health-focused programs, but the data that tell us that perhaps being a skill in implementing and sustaining political models based on democracy may be much more beneficial for health than just simply increasing GDP or urbanization. And I suppose as well that thinking about the global threat from a political point of view of populism, and these are the political model that you may have seen surrounding many of our countries where we've got charismatic leaders, the rejection of experts, there is this mistrust of public institutions. Populism is really bad for health and for planetary health. And you can see on the graph on the right, the increase around the world of the populist flavor of politics and the impact that it could have on health. If you're thinking about addressing the gap that we have currently in planetary health and actually in public health, global health, and nursing in terms of teaching political competencies to our students, we have got here some recent work we carried out where we identified some of the flags that will help us promote political competencies among our students, and particularly being member of any civil society organization, whether it was a sports team or whether it was a hobby society, something as apparently as detached from that bigger picture as being working for the local common good. Maybe that starting point that we need to foster in our students, so then little by little they can end up involved in policy making, policy shaping, politicking, lobbying, and the whole political process. If you're thinking about, well, what is it that we need to research in terms of political competences and planetary health or planetary nursing, we already have got really insightful and exciting in a way suggestions about what is it that researchers, what is it that policymakers, but also what is it that nurse leaders should do in terms of fostering collaboration and transdisciplinarity to be able to develop political competences. So you have got there some of the suggestions from a recent policy brief, identifying how, for example, nurse leaders should focus on very pragmatic areas such as raising awareness of health implications of climate change and advocating for increased financial investment. All that makes sense as so it does raising awareness of the potential for planetary health solutions. But towards the end, we have got that collaboration with organizations and advocacy for greater co-design and co-creation. So I think that many of our nurse leaders are doing some of those things. It may be that they're not really applied to the planetary health and political competency arena. And we must really embrace any of the opportunities that there are available for us nurses or for planetary health researchers, educators, and practitioners to be involved in planetary health diplomacy, and particularly linking to ensuring that we're measuring much more that GDP, we're measuring that planetary well-being and happiness, including planetary health among the indicators of health security and global security, and making sure that, again, that transdisciplinarity which comes naturally to planetary health is also reflected in the collaboration and efforts to work towards that global planetary health diplomacy. If you're thinking, hang on, this has got nothing to do with any work that we've done before, you may remember the Nursing Now initiative 2 or 3 years ago and how that kickstarted from a political arena, and was highly supported by policymakers and politicians around the world, and how it demanded and advocated that nurses got involved in that sphere of nursing practice. And particularly for me, I think that in addition to the clinical and managerial and educational and sort of like a research pillars, we should include that as citizen advocacy or planetary advocacy as the pillars of nursing practice. Coming to the end of the reflection on this aspect, if anyone is thinking that this has nothing to do with their nursing practice, most, if not all, codes of ethics and code of practice and regulatory documents highlight their responsibility towards the involvement in global health. And I've changed here a couple of those points to shape them towards planetary health, that collaboration with nursing organizations to address planetary determinants of health rather than the social determinants of health, the focus on the causes of the causes. We can go all the way to those causes that I've shown you before, the advocacy for equity and social justice that's common to the planetary health education framework, and that collaboration to address the current and emerging social issues. Clearly, I think that planetary health requires planetary activists, and if Greta can do it, I don't think there are any excuse for any of us not to be involved as activists in any way, shape, or form. So, very little leeway for saying, well, this has nothing to do with me. And thank you ever so much for this opportunity, and I'm really grateful for any questions you may have. Thank you.
Thank you, Enrique.
Enrique, thank you so much for your presentation. I really think this is really important when we think about moving forward in the movement of planetary health. And you showed us some of the competencies and where we're going. Can you comment, is there any movement now in terms of moving these competencies into place and that kind of thing?
I think that this is an emergent area, and all we have at the moment is the recognition that political astuteness or the various concepts and labels are pretty much the same, demonstrating that awareness of the politics, policymaking, politicking game. I think that we have got a few emerging papers and a few interesting centers and people, but we are quite far away from having a clear vision about what are the competencies that will be applicable to planetary health practitioners, planetary nursing practitioners, researchers, educators. I would love to have that clear set of competencies that we can teach our students and we can foster among the planetary health or planetary nursing community. But I think that we're quite at the beginning, and I haven't really seen many people talking about these aspect. It may be actually that not many people agree that this is essential and to the core, but it feels so fundamental that these bigger picture changes will not happen downstream, will happen at the uppermost upstream, if that makes sense.
Thank you very much.
All right. Thank you, Enrique.